So Dr. Joe's gonna lift his left leg. He's gonna sink into his right knee just a little, letting it sink, and then he's gonna put his left toe down, and that's gonna be serving as a kickstand. That angle of the knee, that positive shin angle with his knee forward of his ankle is not going to change at all for this whole exercise. He's gonna keep that shin angle and that knee slightly forward. Dr. Joe is gonna put his left hand, his fingers on the crease of his right hip, and then his right hand is gonna be touching his butt, the back of his hip, where his pocket would be. So a little bit more where your jean pocket would be if you had jeans on. Okay? From there, without allowing the knee to move, Dr. Joe is gonna move his hips back or push his butt back, 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 while keeping a long spine. Good, you can stop right there. So his knee did not change. His knee is still slightly forward of his ankle. His butt is back. From here, we're gonna shift all of your weight forward without changing that angle of the knee, almost to the point where you're trying to look over the ledge of a cliff. You might even notice that your heel is slightly popped off the ground. We're gonna hold that position and take one breath. We're gonna breathe in through our nose and out through our mouth. And then we're gonna start to stand. So Joe is gonna guide his hips forward with his hand, his right hand. He's gonna push his glute forward. He's gonna stand tall over that bent knee leg right there. Let's do 3 reps. So now Dr. Joe's gonna push his butt back while keeping his knee slightly forward. Butt's going back, butt's going back, butt's going back. A little bit more. Okay, so there's a cliff in front of him. He's trying to look over it. So he's gonna shift his nose, everything forward, and that's actually gonna allow him to push his butt back another inch. Can you put your butt back, push your butt back a little bit more? There we go. What are you feeling, Dr. Joe? Touch it with your right hand.
Outside of my hip.
Okay. From there, he's gonna use that same right hand to push his glute forward to stand. His hips are only moving horizontal. They're not going up and back, not going down and back. They're going directly back. He's gonna do 1 more rep. The angle of his knee is not gonna change. His butt's going back. He's keeping that long spine. When you feel like you can't push your butt backwards anymore, then you've hit your limit. When you've hit your limit, now shift some weight forward like you're trying to look over the edge of a cliff, and now you should be able to push your butt back another inch or so. Good. Shift your weight forward again. We should see your heel almost popping off or popping off the ground. Let's take 1 long breath in through the nose, really long exhale. Trying to stay nice and long from the top of your head to the bottom of your butt, and then he's gonna start to stand all the way up, 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 up. And he's completed a 3 rep set.